Welcome to the Birth Lounge Podcast, an empowering space for expecting and new parents to hear candid conversations with experts, support your mental health, and learn the tips and tricks that thousands of parents have used to craft their ideal birth. We will answer all of your questions, the scary ones and the weird ones, to help calm your fears and feel confident going into your birth. I'm going to help you redefine what birth and motherhood looks like and how to embrace your journey. I've intentionally crafted a list of experts to help you navigate pregnancy, explore your birth options, and plan for postpartum so that it can be a time of soaking in your tiny human. We're going to go there on all the hard topics so that you can dive deep into finding your confidence and freeing yourself from fears around birth. With over 10 years of experience in family education and a master's degree in human development and family studies, I created this podcast as a way to share the resources parents need to make educated and informed decisions about their care in pregnancy and childbirth. This is a birth community driven by evidence-based information and research in hopes to help you explore your options, understand your rights, and know what choices you have along the way when it comes to birth and beyond. I'm your host, HeHe. Now let's get to the good stuff. Heidi, welcome to the show.
Hi, thank you so much. Oh my goodness, I'm so glad to be here and talk with you today. This is so fun.
Heck yeah. I always love having people on the podcast that I've previously met in real life. It just makes it that much more special. I get to meet so many fun people on the podcast, but when it is people that I know in real life, it just brings this like extra special kind of little feel to it. Today's
Oh,
episode is actually not one that's super happy and bright, which is a little bit different than the feel of our normal podcast. But before we hopped on recording, I was sharing with you that death is very uncomfortable for me. And I was surprised to learn that a lot of nurses share in that same sentiment. And they also want education,
mhm.
information, resources, skills to help people who have lost a baby. And this isn't something that I think is readily available. A lot of nurses that or for me, the ones that I have spoken with after I've been sharing my journey in learning about how to support families of loss was that they felt thrown in. They didn't really know what they were doing. And it's a hard experience for everybody. And the nurses, they wanted to do better, but they didn't really know how to do that. They didn't know where to find the information, and it's taboo to ask questions about it. And so for me, I'm super grateful that you're here today. I'm very excited to dive into this topic. And I think that at the end of the episode, people are going to definitely have the feelings that we talked about something heavy, but you're gonna have a lifted feeling of, okay, while death definitely happens in birth, it's just something that happens. I can be the best nurse for that family and I can help them feel loved in a time that they may not feel loved at all. So before we dive in too much to what nurses can do, can we start with the conversation that I think we were having before we started recording, which was you may be a nurse that actually doesn't experience this at all in your career. Tell us about that.
Yeah, so I think it just varies based off of like how large your facility is and just how the day plays out. We can't plan for these things. You may not be there for the day that they go home, or you may not be the nurse that is the one that is doing the footprints or doing the bath or doing the pictures or those things that you definitely will get exposure to it in some point of your career, but you may not get like the whole full thing. And it's just like this like big heavy weight that I think a lot of nurses have that you're just, oh man, when is it going to be my turn? And as nurses, we're very mindful of each other too, that we'll be like, if we have a nurse that's pregnant, we won't assign them to that family because it's like this whole thing that it's obviously not fun for the nurse. It's also not fun for the family then to see this pregnant nurse like having the thing that they wanted so bad and now their story's like completely different. So there's a lot of like thought that goes into that I don't think a lot of people realize, that it's just kind of, yeah, it's this whole experience that you may not be fully submerged in your career. And we don't get really good training on it. I can't speak for everybody, right? Everybody has a different experience, but it was definitely something that I learned by doing and getting thrown into it. And oh, okay, we have to like figure this out. And you learn these little things that are definitely not on your radar when you go into labor and delivery. It's not something that people focus on.
Yeah. Was it talked about at all in nursing school, or was really the first time you've experienced anything like this at your job?
It's definitely talked about in nursing school, and you learn more like statistical side of it, or that it's something that has happened. But as you mentioned, it's something like taboo that it's not really taught about. Like I did not learn how to care for these patients or how to take care of the baby or anything until I was on the job. And it was just like very eye-opening to me. My first job that I had in labor and delivery, an extremely supportive staff that I remember the first loss that I had. I was like overwhelmed and I was like, oh my goodness, what do I even say to these people? What do I do? And you just feel so helpless in this helpless situation. And I remember the charge nurse just like hugging me in the hallway as we're like sobbing together and telling me like, okay, this and this is what you're going to do. And I'm like, are you going to come in with me and be with me? And she totally was, but it's just like things that you don't think about. And one thing that really everyone has things that irk them or like their ick that they have. And for me, is when people find out that I work in labor and delivery and they go, oh my gosh, that is the happiest place in the hospital. If I were to be a nurse, that's where I would want to work because you just hold babies and everybody is so happy to be there. It's the one place in the hospital where people want to be at the hospital. And it's just like smile because you're not going to be like, actually, like we see really horrible things, right? You're not going to necessarily always say that, but it is the happiest place until it's not. And it's just, we also see really hard things. And what I do believe is that when people walk into our doors and walk out of our doors, like regardless of what the outcome was and what happened, inside the hospital there or that brought them in, like their lives are forever changed, whether that's for the better or for the worse. And we are just with them for this little snippet. And so I just think it's so important to really try and make that experience as good as possible. I had a loss with a patient a few months ago, and I always keep all the cards and stuff that I get from patients. And I had this card from her, and she was thanking me for the care that I gave her and to her husband and to their baby that they lost. And I feel so weird saying, thank you for making my experience so wonderful. And I don't know that I can actually write that. And she wrote this in the card. And I guess what I can say to you is that thank you for making the worst days of my life tolerable. And I think that just really resonated with me. And that's what we're trying to do because ultimately it is horrible. There's no way around that. And that's usually what I lead with when I go into the patient's room and introduce myself with this. I'm like, I'm so sorry. This is horrible. And there's no way around that. And these next few days are going to be the worst days of your life. And we're just going to work through it together and just take it in chunks and strides.
You're
And
a
there's
little
going to
bit
be
of a
times where we're
therapist.
laughing. Yeah.
Yeah.
Yeah, you really
You
are.
literally bring your heart and you say there's nothing I can do to fix this or to
Mhm.
take this pain away, but you don't have to do it alone. I'm here with
Yeah.
you. Okay,
Yeah.
so do you as a nurse, for all our little baby nurses out there that are
Mhm.
listening, and or maybe older nurses who are like, I've been a nurse, but I've never experienced this. Do you always know what you're walking into? Or sometimes are you the one that discovers, I think this baby might not be with us anymore?
So it just depends. Sometimes you are the one that discovers depending on what they come in for. And there have been times where they've come in for other things and then you ultimately discover that. As a nurse, like we can't pronounce that somebody's dead or call time of death, right? So in those situations, we can't find heart tones. And it's no secret. I I just they know that something's wrong and they sense it. And it's just this like gut feeling that they have. And they can tell when you're moving the monitor around trying to find a heartbeat and you can't. And I've been on that side of it too. And I've just said, I'm doing all of my normal things to try and find your baby's heartbeat. And for whatever reason, I can't find that. And so we're going to need to bring the provider in, and then they do an ultrasound to actually look at cardiac movement. And then they're the ones that say that. And then there are other ones that they've discovered that in the office at an appointment. And so they know coming in. So it just depends on what brings them in.
Sure. One thing that I heard you just say was, like, without saying it, was keep your patient in the know. So tell them, be upfront with them. I'm having a little trouble finding it. It could totally be me. Let me go
Yeah.
get a provider to do this. I'm having a little trouble locating your baby's heartbeat, but I'm not exactly sure if I'm doing things right. Let me go grab somebody else. Let me go get
Hmm.
somebody else in here. I think that hurried, emergent feeling without explaining to them what's going through your
Yeah.
brain, without explaining to them what you're seeing, without explaining to them why you're bringing extra people into their room can
Mhm.
be a deeper level of trauma. It's okay. I already knew that something was wrong. I knew that we usually find my baby's heartbeat way faster than this. I could tell
Mhm.
that she was starting to panic. Why is she not saying anything to me? I think that a lot of us, especially the people pleasers and the empaths out there, and I think that probably covers a lot of nurses, just those two. But
Oh yeah, totally.
when you think about a nurse who's in that situation and she's trying to decide, okay, do I say something or do I not? What's your advice to them?
100% say something, because I had mentioned before and you acknowledged is that you just have this gut feeling. You just know. And I think the worst thing that you can do is try to act like everything's fine or tell them, I just can't find it, but everything's fine. Because honestly, like you don't know. You don't know. And you can't make that promise to them. And I think that even though it's really hard to say that, you don't want to be the one to be like, I can't find your baby's heartbeat. And they know, they can tell by your face that it really builds the most trust, just being honest with them and being vulnerable with them and really humanizing yourself to them.
Yeah. Okay, walk us through your role as the nurse. So we have discovered this and or someone has come to us and their baby's no longer with us. Now, what are we going to do and what can that nurse do to be the best support in what they're about to face?
I think going in and just sitting down and having a conversation with them and acknowledging how horrible this is, asking, do you want to take some time just to be by yourselves and process this a little bit? There's going to be a lot of things that we need to go over and talk about. And I'm really honest with them, like about expectations and like talking about we're still going to have to go through labor and what that's going to look like. And just tell them that all of this is so overwhelming. And when you're in this grief process that you've just been thrown into, that it's just like your world's falling apart, that you've gone from, oh, I thought we were going to show up to the hospital and get all settled in, put my cute little robe on and meet my baby. And now it's like, I'm meeting my baby while also saying goodbye to my baby, this baby that I've planned for and had all these thoughts in my head of what their future is going to look like. And that's just all ripped away. So I think you just take it in stride with a patient and just see where they're at, because everybody totally grieves differently, and just explain things to them as you're going along. Otherwise, it's just too much for them to process all in one sitting.
Yeah, it's just a trauma that like can't really be overcome at that point.
Mhm.
Yeah.
Yeah.
Is there language that you either should or shouldn't use? Do we have any sort of data where this is definitely better or this will help reduce the trauma or just this often feels offensive, so try and use this language? Anything like that?
I don't know that I have statistical data on those sort of things, but just I can just speak from my experience is it's still their baby. And so ask them if they have a name picked out for their baby. And if they don't, encourage them to still name their baby and call their baby by their name. How like we talk about how patients don't, it's call them by their name, don't call them mama. It's like that same sort of thing. And because in this room, really, you guys are the only ones that are going to be experiencing this child and seeing this child, other than maybe they may have some family that come in and visit, but outside of those walls, like no one else is gonna ever know their baby.
Are there any other questions that nurses can ask, or maybe things that you could offer your patients to preserve the memory of their baby? I assume this will change from facility to facility depending on just like access and obviously financials of the facility, but what are
Right.
some common things that we might see?
So I always ask them about pictures because that is a really important part, and really try to encourage them to have pictures. I'll offer to take them on their cell phone, or if they're just like, I really don't want them. What we've done at the facilities that I'm at is we have a camera and we'll get like a little memory card and take pictures. And we have a special box that we give them with all this like memorabilia and put that in there for later. And I think that's one of the biggest regrets that patients have is if they don't take pictures, because it is so traumatic, and it's like they don't want to see it, but also those are the only things that they're ever going to have for their baby. And so I'll talk to them about that you may not want to see them right now. You may not want to see these pictures right now, but you may later, or you may not. But we should just take them because this is our chance to do that. I also encourage them, if they had an outfit that they wanted them in or a blanket, that we still put the baby in that we still wrap the baby in that. And I'm really honest with them too about what the baby's going to look like when it's born. Like, depending on how long ago the baby passed away, that's going to affect things. And just like being honest that the baby's not going to have the tone of a baby that is born alive, and to prepare for that, or that they're going to be purple or gray in color, or they may have some bruising and spots, or their mouth may be open, just to prepare them a little bit for that so that when they see it, it's not quite as, whoa, okay, I was like not expecting that at all. Not that anything can ever really prepare you for that, but just like laying a little bit of the groundwork and like talking to them about, okay, when the baby comes out, do you immediately still want the baby skin to skin with you? Or do you want me to take the baby and wrap him or her up and put them in the outfit and then bring them to you? That kind of thing. We also oftentimes will do a bath just so that they still get that, and talk to them about, do you want me to do the bath and record it? Or do you want to do the bath and have me record it? Like those sorts of things, so that they just have an opportunity to think about that and they still have birth preferences. It's just different, right?
Yeah. I think prepping them for what their baby is going to look like is probably one of the most important things because I think when this happens, our brains don't immediately go, this is not going to look like the baby I thought I was going to have.
Yeah.
That can
Yeah.
be really startling. Is there anything that nurses need to know about handling a baby in that state in order to properly care for them?
Yeah, so they're pretty like fragile, right? And as I mentioned, they don't have the same tone as a baby that's alive. So they're very, for lack of a better word, floppy. And
Hmm.
so I think being cognizant of that, and with positioning too. And some people are just like super traumatized and freaked out by how the baby looks and can't ever really get over that, and will hold the baby for a while and then done and don't want to see the baby anymore, versus people that want to hold it a lot. And I, again, learned this by doing. They are, they start seeping. And so you don't want to, like, stuff will stick to their skin and it can peel their skin off. And so it's really important to, after they're initially warmed up, is to preserve them longer so that they can hold them longer, is to keep them cool. So some places we have a cooling bed that the baby can be in. And I'll always tell them, like, okay, like, remind them that every so often, like, they need to put the baby back in there to preserve that. And if they have an outfit that they want on, I'll put that outfit on the baby. I'll still put a diaper on the baby. And then I'll actually put like a Chucks pad, like fold it up and put it behind the baby. And then put the blanket that they want on the baby than around so that they still have their blanket touching their baby. But that kind of helps because otherwise you do get liquid that kind of leaks out and it's alarming.
Yeah, I'm
Very
sure that would
difficult.
be very
Yeah.
startling. On average, how long are you seeing people stay with their babies postpartum like that?
It just depends. It
Hmm.
really depends on how they're processing things. And I've seen families that have been like, I don't even want to see the baby. And then they change and do see the baby, hold the baby for a while. And then they're like, okay, we're done. And that's it. Or you may get patients that think that they're saying that, okay, I'm saying goodbye. And then they want the baby back. Or I did have someone recently that actually had the baby in for the entire stay and they kept pushing back the day that they were going to go home because they didn't want to go home because that meant that they were going home without their baby. And they just were having the most difficult time like coming to grips with that. And so it can depend. It may be a few hours, it may be up to it was like 3.5 days.
Yeah. Oh my gosh, that is so tough. I promised myself I wouldn't cry, but that one almost got me. That's so
No.
tough. You mentioned really encouraging people to take pictures, even if they didn't want to see them right now. Do you take that same approach with people who say that maybe they don't want to see or hold their baby? Do you have a discussion about maybe I know this is a lot and I know this is really different than what you had envisioned for your birth, but and then if you do that, what are you saying? How can nurses gently encourage their clients without obviously pushing too much of encouraging them to spend some time with their baby?
I just tell them you don't have to make a decision right now, but this is something to think about. And while it seems impossible to think that you'd want to look at those pictures or take pictures or hold your baby in this condition, you also thought you'd never be here. And here you are going through it. And so just take some time and think about that. You don't have to make that decision right now. And a lot of times they will change their mind. And if they do say, like, initially, I don't want to hold them or see them, they do usually always change their minds. Because
Yeah,
it's just a natural trauma response that you're just like, get me out of this situation, this like horrible nightmare.
totally. Wake me up from this nightmare.
Yeah.
Oh, so unfortunate. It's not something you can wake up from. So, this may be one of the most morbid questions I've ever asked on this show, but I feel like it's really important. And I'm trying to think about if I were a new nurse, what would I want to know going in to support these families? And so that's where this question comes from. But is labor different with a baby that's not alive than a baby that is alive? We obviously don't have continuous fetal monitoring since there would not be anything to monitor. But from a nurse's perspective, are there differences that you're looking out for? Are there marked differences between labor patterns or what contractions look like or the length of labor or anything that would nurses might need to know, or even doulas listening, non-medical, but are there things that people supporting these labors might need to know?
It just does depend on the situation. Definitely if they are earlier, like 19, 20 weeks in there, even up before term, before like even very preterm, they're at a higher chance of the placenta not detaching because the placenta isn't really like made to detach at that time. And I think just being mindful that telling them if we are giving you Pitocin, you are going to have a contraction monitor on you and that they're still going to have the same amount of pain that they would if the baby was alive. And I think sometimes we're like, oh, well, we're not monitoring the heart rate. So it's different. And it does seem like so ominous and weird, but just like being mindful of that. And then also too, like they're at a higher risk of like infection and bleeding. And so watching for those kinds of things. And yeah, just being mindful of their pain because it doesn't hurt any less, right? It's
Yeah.
still going to be the same. And then just you have this whole other added layer of coping, and they're going to have moments where they're sobbing or they seem okay, or you guys are making jokes and laughing, and then all of a sudden they're like, I feel so guilty that I'm like enjoying this
Joyous,
moment or something,
laughing.
right?
Yeah.
Yeah. And so just navigating that, and hopefully you work at a facility that has like very supportive staff. I feel like as nurses, like we do have like our tribe that we're close with, our group of people, and just leaning on them. So at the first facility that I worked at, we had a really robust loss program that was really built by all of us nurses collectively as we experience loss, like being like, oh, this is something that we're like totally missing or didn't think about. And so we actually put together this whole binder of like fetal loss like 101 and gave tips on like how to wrap the baby. One thing that I was talking about, how they don't have tone. It can be very startling for parents with the mouth, because the mouth will also like hang open. Swaddling them in a way where I'll bunch up their fist and put it under their chin and their other little hand on their face. So then it still looks really sweet, but then it's also keeping the mouth shut. It's just things that you never think that you would have to think of. But I think little tips like that are really helpful. Anyway, so we created this whole thing of here's what to do, here's the best way to do footprints and handprints, and try to do those earlier on if you can, because as time goes on, they're going to start decomposing and then the skin starts sloughing off. I know that sounds like very graphic, but just like being mindful of those things that we don't think that we like ever have to think of, but here we are in this situation and we got to figure it out. Anyway, so we created this whole thing that was like so helpful for all of our staff, and we had really nice boxes for the patients with a blanket and a special teddy bear and kind of some other things so that we can give it to them, that when they leave the doors, they are still carrying something out. Yeah.
I have been around lost moms who had children over a decade ago that still carry around their boxes and they still go through their boxes and they still add things to their boxes. Those boxes, I think, mean more than a lot of people know.
Yeah. Yeah. I think that's so, it's just so special to do those little things. And just like, it doesn't seem like a lot to us that you're like, oh, you're giving them a box when they were supposed to be having a baby. But it's
Mm,
like, it's still like just so I agree with you. It's so touching to patients to have that and be like, these people knew and cared for me and for my baby when no one else is ever going to know them or see them or hold them. That's another thing I wanted to mention is that I'll tell like nurses that if I'm like training or helping, if their patient has had a loss and I'm helping them navigate through things, still ask them to hold their baby. I think that's something that we don't think about a lot. And then you think, oh, their baby's passed away, you aren't going to hold it. No, it's still their baby and it's still so special to them. And I think that it's really like meaningful to do that if you feel compelled to do.
yeah. Oh my gosh, yeah. What else goes into that patient box? So you've mentioned handprints and footprints, pictures. What else are you putting in there? Are you saving a piece of the umbilical cord, which parents that have alive babies would eventually be able to get after it falls off? What kind of things are we saving for these parents?
Yeah, so all the things that you listed, and it just differs like facility to facility. We have a couple of like books that have been written about loss, some resources for support groups. I know that's something that's really helpful to patients. Also, we'll do little like hand and foot castings. We'll have those in there. And I think those are really nice. I know some places they'll have a teddy bear and there are ones that you can purchase. And it just, again, depends on the resources of your facility that you can fill to the actual weight of what their baby was. So I think that's really cool. The facility I'm at right now, I'm actually trying to get those there, but they're pretty expensive and it's hard. It always comes down to money, but those are like the main things that are in there. A blanket, they each get a special blanket in there. And then we do a card from the staff that we
That was
all
present.
sign.
Yeah.
Hmm. Yeah.
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 It must be really hard. I know I'm bouncing around, but it must be really hard as a nurse to only see someone's snippet of that journey. I think that's a shared perspective of, oh, I could be with a patient for 8, 12 hours and I don't even get to see their baby be born. But I think this may bring a little different of a feel of, I was there when this baby was born and I didn't get to finish out with them, or maybe I wasn't there when that baby was born and this is the family that I got assigned to when I got to work. Talk to us a little bit about the support that is present for nurses. And again, this is going to obviously differ from
Yeah.
place to place, but what are we typically seeing? And then I think in an ideal world, what would we see?
Yeah, I think it really, again, depends on where you're at. But where I'm at, we're all very supportive of each other with staff and very aware of what's happening in each other's rooms and just being there and checking in on that staff member because nobody else is. At the first facility that I worked at, where we created this really like robust program, we actually created this whole care cart for the nurses so that just filled with like little like trinkets like lotions and gum and hair clipping, just little things like that, that when you were going through that shift or whatever, that you could have a little kind of comfort thing. But I think the main thing is just like leaning on the support of your coworkers because they're really the only ones that are going to understand it, because you still, at the end of the day, you're going home and your family's not really going to understand that. It's just, it can feel like very isolating. And it's definitely something that's imprinted on us. I know for myself, I've been in labor and delivery for a long time and like birth after birth. And you can forget patients or things blur in your mind. But when you've experienced a loss with a patient, it's like you never forget that patient. You never do. And we don't, like we take that home with us. We remember them. And on a happier note, a lot of times then they'll come back in and have another baby. And so we really try that if the nurse that experienced the loss with them can then be there for now this like totally different birth experience, it's really cool to be able to be part of that and see things like come full circle.
Yeah, that's what those were the words that came to my mind was full
Yeah.
circle was you
Yeah.
get to just complete that story because it
Mhm.
doesn't replace it. I've had lost moms on the podcast before, and one thing that they're always very sure to say is just because you get pregnant and you have children after a loss does not mean in any way that it heals you or it replaces you or it makes your loss any better or lighter, but it completes that story and it gives you a chance to restore hope, restore maybe a little faith in your body, restore that story that felt incomplete.
I think so, because I feel like from a patient standpoint, which I can't fully speak to that because I haven't experienced that myself, but just I had a good friend that had a stillbirth it'll be 2 years ago this Thanksgiving. And they now have a 6-month-old little girl that we just got to meet a couple weeks ago, which was just like so special. But she was like talking about how she's like, yeah, it doesn't replace that or whatever. But it also, yeah, it just does restore faith in your body because she's like, your one thing that you're supposed to do is be able to be this safe place for your baby, that you can grow this baby and take care of it. And what do you do when this happens? You feel like it's your fault that your body has failed you. And then also like from a nurse standpoint, we talk so much about having your patient have a positive birth experience and like how do you do that when there's this loss and this horrible thing happening? And so you feel like you've almost failed a little bit too, that you're like, oh, they're just so miserable and there's nothing that I can do about it, but there really is. And I think just being honest and vulnerable with your patients just goes a long ways.
Yeah, I love how you said just tell them this sucks. I can't fix this. No one can fix this. It's gonna hurt for a little bit. And I'm sorry that you're in this hard place, but you don't have to do it alone. I'm here with you. And I think that holding space is so powerful and something that nurses can say. I think we probably all learned this from Jen Hamilton. Now everyone has their own version of it, but I've been here before, or I've done this before, or this is the first time that you're walking this path, but I've walked this path before. And I just want you, I'm here with you. I'm here to answer any of your questions. I'm here to
Yeah.
hold your hand. I'm here to give you resources. I'm here to just listen to you if that's what you want. Okay, another kind of morbid question, but again, I'm trying to think from the lens of if I was a new nurse, what kind of questions are nurses having with patients, and how do you present the conversation of what we will do with your baby next?
Yeah, it depends on the situation, and it's really hard because there's such a huge variance of things. And so usually what will happen is we'll tell them like, do you guys have a funeral home picked out? And we have a list of local funeral homes and whether or not they want to bury their baby or if they want to do cremation, that kind of thing. And so we'll actually give them that list and be like, what are things that you want? And even I've called for them before because they're just like, I cannot make this call, and have them like be thinking about that too. It just depends on the patient. So some of the patients will be like, I want the baby in the room until we leave, and or they want the baby like taken away after. It depends on your facility. So either the funeral home will come and pick the baby up before the family goes, or they may do it after. And it just, you have to talk to the family about that and see what they want. Some patients will say, okay, I want the baby out of the room, but they're not necessarily ready to go home yet. And so then the baby will go down to the morgue for a while, and they may say that they want the baby back. And so then you'll have to go back and bring the baby back up to them. The most recent loss that I had, the family, like I said, they stayed like the longest that I've seen somebody stay in the course of my career. And they actually were like, can I walk my baby out? And for a second, I even had to stop and think and be like, can they? And then I'm like, why couldn't they be able
Yeah.
to? Just like, I was like, I've never experienced that, but that is such a good thought and idea that yes, you should carry your baby out. Absolutely. We're going to do that. And so then that's what they did. That's what this mom did. Cause she was like, I can't leave him here because I feel like we're abandoning him if we walk out those doors and he's still in here, that I want to know where he's going. And I was like, okay, that makes sense to me. And that's 100% what you need to do. And we still learn stuff all the time. And so that was like a big point for me that I was like, wow, that's a really good thing to mention to patients and to offer, because we talk about how they leave the hospital with empty arms, right? And even though she was walking out with her baby that wasn't alive, she was still walking out with her baby and taking her baby to the next thing that was going to happen. So then we just planned with the other nurses on the floor, hey, this is what's going to be happening. Can you just make sure that there are no other patients walking in the hall with their babies? Because that's like a whole other thing. And we did that for that mom. And it was heartbreaking to do that walk with her. And I just remember her coming out into the hallway and just breaking down in the hallway, and her mom and her sister were there and were just crying on my shoulders, and I was crying with them too. We had spent the last like few days together, and walking her baby out and handing him off to the person from the funeral home, and then her just like dropping onto me once she handed off her baby, and just having the most guttural mom cry that you can imagine. And yeah, it's just something that it is hard to prepare for, but I think it's helpful like knowing these things as a new nurse so that you can think through that, so that when you do have a loss, being like, oh, okay, should mention to them like the option of carrying their baby out if we're able to do that.
Yeah. Oh my gosh. Nurses just play such a special role, and it's true. You guys are there for our best days, but also our last days. Okay, you got me. You finally got me. I am
I got
definitely
you.
crying.
I wasn't trying to make you cry.
No,
I
that's
know.
okay.
It's yeah, I cry with my patients about this. It's just
Yeah.
cry with my other nurses. Like it's
It's
just hard and
hard.
it never gets easier. But it's such an important part of our job where it is something that I do really like cherish about my job, being able to support people through these like horrible things that are just unforeseen and we can't do anything about them, but just embracing it and trying to like really make the best of what really are like the worst days of their life, the day that they come in and find this out or learn that while they're there, or also then the day that they leave.
They have to birth their baby. Yeah, which traditionally is only talked about as a joyous time. So, right? So then you have that mind fuck of this is actually the worst day of my life.
Yeah.
And there was this expectation that it was going to be life changing in a wonderful way.
Hmm.
And it's life changing, but certainly not in a wonderful way.
Yeah, totally. Yeah. And I think having those conversations too. I think one thing that I didn't realize as a nurse until I was in it too is then some people are really apprehensive about wanting to still deliver their baby. Then when it's this whole different thing, they'll be like, I don't want to do this and I just want a C-section, which I found was really interesting and not something that I was aware of. So then that just requires a conversation with the provider. And I feel most of the time that they don't choose that. But I have seen patients that have chose that because they're like, I don't want to go through the labor or prolong this anymore. I just want to get it over with.
I totally understand that.
Yeah.
If I wasn't a doula and I didn't know so much about C-section, particularly C-section recovery, I could definitely see myself resorting to that and just saying, I don't want to do this. Just give me a C-section. I don't want to go through labor. I'm very privileged in having the knowledge that I think I would
Sure.
not want that. But I
Absolutely.
totally, that resonates with me so deeply. I
Yeah.
really get it. It goes back to that human instinct of get me out of here,
Right.
in this as soon as possible.
Yeah, like we're constantly looking for a way out. We are not safe here. This is not a good place to be. Get me out.
Yeah. So one of the mantras that I use a lot with my clients is you are safe. How does that land, Heidi? Does you are safe, is that a good phrase to say to someone experiencing loss because they themselves are safe?
Mhm.
Their baby obviously is not. Maybe you should say something like, you're safe to feel whatever comes up for you. You're safe to ask me any questions. How can you, as a nurse or a doula, any doula listening, or an OBGYN or midwife, anyone who's caring for someone who's experienced loss, how can we convey to them that they are safe in that space and with us as
I think how you worded it and the examples that you gave were perfect because it's like things don't go as planned, as we know, and still acknowledging that they are, regardless of the outcome, they are still in this environment that is unfamiliar to them with people and things and interventions that they may not be familiar with. And then now it's this whole other added layer of the interventions seem different and the gear and direction of everything has changed now, and just acknowledging that and telling them, hey, you can ask me whatever you want to ask me. No question is a dumb question. I know that there are going to be moments where you're crying or where you're laughing or where you don't want to talk, and that is fine. And you don't need to explain or apologize to me for anything. Because I think that's something too, is then people almost feel like guilty that they've just been like crying so much, or that they don't really want to talk, or that they just don't really know how to feel and they feel like lost. And just acknowledging their feelings and just telling them like, hey, it's okay, this is going to be hard and I expect it to be, and I'm still here as your advocate. That has not changed. My role in this has not changed.
yeah, oh my gosh. So that's what our team does as doulas when we have someone who has a loss in our community or in the birth lounge or a one-to-one client.
Mhm.
We also postpartum after they're discharged from the hospital, we're checking in frequently. We check in frequently regardless of with all of our clients, but especially with someone who had to leave the hospital without their baby,
Mhm.
and will never get their baby. So different than someone who has a NICU stay. What kind of support, and maybe the answer is not much because we're in the US, what
Yeah.
kind of support can someone expect from the hospital system after they're discharged in terms of, is your nurse calling? Are doctors going to check in on you? Should we expect to be called back for a 6-week appointment? What does that look like?
Yeah, so I think just having that conversation is really important. They will still have their initial same postpartum visits because it's weird to think about or wrap your mind around it, but it's they still birthed a human. None of that has changed. Talking to them about that, talking to them about, hey, your milk is still going to come in. And this is what that's going to be like. Talking to them about postpartum depression, talking to them about what is your support system. So, like taking an evaluation on that, because some people have great support systems. And as we know, like not everyone does or is like fortunate to have that. And so, looking at what our other like local resources are, I do think in the US, like we do not do a good job postpartum at all. Oh my goodness, it's crazy. But then as far as like the nurse following up, I think it just depends on the facility. So the place that I've talked about this a few times now that I had originally worked at that had this like robust program. So what we did was we actually had a nurse that was like appointed to fetal loss. And so anytime we had a loss, like we would write that information down and we had a list and like what the baby's birth date was. And she would call and check on them like a couple weeks out and then always on the baby's birthday, like at the 1 year mark. And then we actually had this like amazing thing that I've been trying to get this at the hospital I'm at now, but it's just hard because we're a larger system and they have to like all do it, not like they won't just do the one off. I'm trying to change that, but they do a remembrance service every October, which I think is so cool. And so every family that has had a loss is invited in the last year. And then it's also like a standing invitation for past patients. And they do this. It's one of the coolest things that I've been to. They do a special little remembrance moment for the babies. They have a flower for each of them and a special spot for each of the parents and their family to sit. And then we have someone that gets up and shares their experience with loss. And so it just provides this like nice little community for them and a chance to, and then a lot of the nurses attend it. And our manager would go and just provides them with an opportunity to like see their nurse again or connect with like other families that have gone through the same terrible road that they're trying to navigate down. And I think that's just a huge help, like knowing that you're not alone.
I think the community just makes all the difference because like we've said multiple times in the episode, you're not going to be able to take this pain away. There's nothing that can fix this for that couple or for that mom or for that family, but just knowing that they have someone with them, that they're not alone, I think is huge. Okay, for a nurse who does make that call,
Mhm.
what are you saying? That
Um,
can feel so awkward. You must call and just have a pit in your stomach where you want them to feel your love and you want them to know that you're thinking about them. But what do you actually say in that phone call?
just it feels so weird asking them like, how are you doing? Obviously you're doing horrible.
Right.
And the first couple of calls that I had done as that person, I said that, and then I was like, that is a horrible question to ask. Obviously, I'm doing horrible. And then as being on the receiving end of it, it's even though you are doing horrible, you don't want to say you're doing horrible. People don't necessarily really want to know, do they? So just telling them that you've been thinking about them and being like, has your family been coming over to help? Were you able to schedule your postpartum visits? Do you need me to do that? Have you found a support group? Can I do that for you? What is something that I could do to like help you get through the right channels that you need to? Have you showered? Have those kinds of things. And again, just like saying how sorry you are and that just that you've been thinking about them. And Yeah, I don't think there's any really one right thing to say, but I think just like acknowledging their feelings and then just doing like a checklist of making sure that they are taking care of themselves or that someone is there helping them.
Yeah. I think the gentle act of even reaching out and checking in is something that so many people don't do because fetal death and fetal loss makes us all recluse. We all feel uncomfortable. No one wants to reach out. No one wants to have that awkward conversation. No one wants to be the person that sits with you while you just cry and don't really know what to say. But the thing is, or this is one of my biggest takeaways from starting to learn about the lost community is you have
Mhm.
to be that person because no one else is going to be that person. So if you know someone that's going through this, just pick up the phone. It doesn't have to be a phone call. You can text them. You don't have to go and sit in their presence, but just reaching out and saying, I'm thinking about you and I love you
Mhm.
and your baby was so loved and they will always be missed and we'll
Mhm.
never forget them. That can be everything. That can really be a game changer for so many people.
Yeah, I think so for sure because as you said, it can be awkward and you don't want to bring it up. And you're like, oh, I don't want to spark these feelings in them. They seem like they're okay right now. But the thing is like they're always thinking about it. And so you are not stirring up anything by saying about it. Maybe they don't want to talk about it, but just like acknowledging that you're aware that it's there. I had seen something on, gosh, it was probably Instagram, let's be honest, but it was like describing grief. And it was like, so as time goes on, your grief doesn't really get better. Like they described grief as like being this like rock that you carry in your pocket. And as time goes on, it's like the rock never goes away. It just feels a little bit lighter because you've adjusted and learned how to carry it. And there are times where you're still gonna feel it there where it does feel heavier. And I think just being mindful of that, that these people are never gonna forget, just like the nurses, like we don't forget. Circling back to, I told you that I had a good friend that they suffered a loss almost 2 years ago. And one thing I asked them is I said, I'm just from a nursing standpoint, what are things that stood out to you in your experience or things that you felt were lacking or could have done better? And they are like the most kind, generous people. Even when they lost Juniper and they FaceTimed us at the hospital and we're just like sobbing together over FaceTime, the first thing that her husband said to me was, thank you for what you do. And I was just like, oh my goodness. Okay. That was not on my radar of like things that you were going to say, but they just like praised how well the nurses were. They were like, everybody was so kind and really cared and cried with us. And that just really meant a lot to us, like that our nurses like cried with us. So I think that's an important message for nurses or other providers listening is we're supposed to be this like strong force that like we know what to do and keep our composure, like definitely, but also it's okay to cry with your patients. And I think that's something really important. And there's obviously like a time and place for that, but it really does like impact them and be like, wow, okay, they really do care. They are human. This is something that's like affecting them too, which is meaningful to them because they're like, wow, my baby really did matter.
And I matter as a
Yes,
mom. And I have people that love me and I have people that love my baby and wanted my
absolutely.
baby to be here with me. Oh my gosh. I love it so much. It's often said that women will remember how they were treated in birth. And I think that even though in this situation we're talking about the birth of a baby that was lost, it still very much counts as they will never forget how they were treated in this moment. To make sure that you're just treating them with gentle hands and compassionate tone of voice and you're just holding space and not pressuring them to make decisions or rush them into things. Heidi, this has been such an informative conversation. I just have one last question for you, and this is for someone who may not work at a facility that has any sort of protocol or procedure for when someone experiences a loss. What are some like quick and dirty, easy, cheap, you don't really need to ask for a lot of permission. You're not trying to rewrite a whole new protocol at your hospital. What are some things that some nurses can do to make a big impact on these families if their hospital doesn't have something set up?
Yeah, I think a couple of things that are really important is a way to take pictures. If you can pull together some money to get a camera and some little cards for patients that don't want things on their phone, that and having a way to do some hand casting and foot castings with like plaster. So us as nurses, like at my facility, we've just gone out and we purchased that ourselves. It's pretty inexpensive, but it's so worth it. So I think having those sort of things that you can provide some like memorabilia for patients if you don't have stuff that's set up. I think those are things that really make a difference. There's also been a new thing out there, which I haven't personally tried it, but I actually saw it at AWHONN when we were there in June, is doing water immersion photos. Yeah, and you can get like a really pretty big glass bowl with like beads. And so you actually soak the baby in water, submerge the baby in water for 20 minutes, and then place them in this bowl of water. And so what it does is it plumps their tissues back up, and you can get really awesome photos of their really intricate features like on their hands or on their feet or their nose. And it just makes them photograph a little bit better.
Yeah. Oh my gosh.
Yeah.
So special. I feel a little bit awful being so joyous at the end of this episode, but I do feel like you've given at least me a lot of steps of things that I can do to make this experience better for people who do find themselves in the situation. As much as we wish nobody would ever experience loss, I think anyone who's in the birth world understands that death and birth are very much intertwined. And so if we're going to do one, we have to be comfortable and be able to support people in the other. So thank you so much for being here, truly. If there were labor and delivery nurses or postpartum nurses or doulas or anyone that wanted to connect with you because something that you said stuck out to them or hit home for them, where can people find you?
Yeah, so the easiest way to find me is I am a nurse educator for bundle birth nurses. So finding me on Instagram, if you search bundle birth nurses and then just sending a DM through there or clicking through the links, and you can email us and just saying, I want to talk to Heidi. That'll be the easiest way to to get to me. And I'll be happy to answer whatever questions or things come my way from this.
I love it. Give me Heidi. All right, you guys. I hope you've enjoyed this conversation as much as I have. I know that it was a heavier topic, but I also know that much like me, you guys were really looking for the answers. You were looking for resources to better support families who are going through this tragic time. You were looking for a place that you could get education on how to better serve your people. And for that, I just want to reach out and give you a big old hug. Thanks for being here, you guys. Thanks for being here always for the good conversations and the joyous ones and also the heavy ones. I promise you the hard conversations are really where all of our growth comes from. It's what makes us the loving, compassionate caregivers that we all are. I'll see you in the next episode. Be sure to ask for Heidi over on Birth Bundle Birth Nurses on social media. And you can find me at Tranquility by HeHe or the.birth.lounge. Until next time, head to your app store and download the Birth Lounge app for evidence-based childbirth education and data-driven postpartum support delivered straight to your phone. Bye. Thank you so much for tuning in today. I truly do value this community and I love hanging out with you. You deserve to have a birth that you love with a provider that values your autonomy and respects informed consent. It's an honor to be your go-to gal when it comes to preparing for your baby. If you found today's episode helpful, share it with a friend. Share it with someone who could use evidence-based information to help them have an informed and confident birth. I'd love to hear what you have to say and read your sweet words. By leaving us a review, you are helping other expectant mamas and their families find the podcast so that we can reduce birth trauma and improve maternity care in the U.S. one birth at a time. If you're interested in joining the Birth Lounge, go to thebirthlounge.com. If you want to connect with me on socials, you can find me at Tranquility by HeHe on all platforms. Until next time, stay educated, stay supported, stay confident. Bye.